The name Naivasha is derived from the local Maasai word Posha, meaning that which heaves. A common Maasai word for bodies of water large enough to have wave action when it's windy or stormy. The name Naivasha rose as the British attempted to pronounce the Maasai word. Vasha, as it's fondly referred to by Kenyans, is not only famous for its tourist attractions, it is also the home of the World Rally Series, commonly known as the Safari Rally. During this season, people come out in huge numbers from all parts of the country to watch as men face it out with the machine.
Nilitumiwa message na hii kampuni ya Zuri Health. Shida yenye imenileta, walitangaza ninapata medical free. Na nikafurahia sababu saa hii watu wanaumia, haifanyi kazi. Nikafurahia sana kukuja kupata hiyo matibabu na ni kila aina ya ugonjwa. Nimefurahia sana siku ya leo. Mimi ninapoenda kutibiwa, ninafurahia na ninaomba Mungu kila ambacho ugonjwa yenye niko nayo nikienda kutibiwa, nipate nikiwa na afya mzuri na nipate matibabu nikitarajia nitapona.
First, I have to congratulate the MPESA Foundation and also the Zuri, because they have done a lot. You people, you are so good. Everybody who was here was appreciating the work. Even the medicine were there. Everything was good. For the whole of this week, I've been going to each and every household so that I can check the people, those who are living with disabilities, those who need our help today. And that's what I did for those the whole of this week from Monday. I've been in the field the whole of this week. The common health problem is about the diabetes and pressure. In fact, we have the challenges about the pressure in our community because most of the, especially where I come from, in my unit, we have adult people. They are very many in our area. So those problems, they have the problem of diabetes and high blood pressure. They have able to cover the whole community people in this area, and it was good. And come again, just consider each and every year, or after some months, you come at our place so that we can able to help our people. So may God bless you, God bless Zuri, God bless MPESA Foundation.
We're here in Naivasha offering a free medical camp to the members of the community. We're here because of partnerships and initiatives of collaboration. Our partners, I'd like to thank all our partners, MPESA Foundation first, because they have really given back to the community through this way. I want to thank Lions Eyesight, a company for optical cover, and our County Government, of course, of Nakuru for being involved in the entire process of making this camp a success. We have seen about 3,500 people from underserved communities who did not have access to healthcare, and we're very happy with the numbers that we've seen today.
Kulingana mi process imekuwa sawa kuanzia registration. Kutoka registration nimepitia kote, maswali imekuwa friendly. Nikapeana details zote ambapo ni ID ndio ilikuwa inahitajika na majina. Kutoka hapo kutoka registration nikatumwa mpaka kwa upande wa macho. Nikaenda nikaonana na daktari wa macho. Ambapo nimepitia vipimo akanituma mpaka kwa yule wa kupeana dawa. Na kwa dawa nimepewa dawa na nimekuwa referred nafaa niende hospitali yenyewe nionana na daktari mwenyewe mkubwa, ambapo ni shukrani kwangu. Hiyo shida nimekuwa naona ikiisha sababu nimepewa dawa hiyo, ambapo nashukuru MPESA Foundation pamoja na Lions Club International. Pia Zuri Health nashukuru sana kwa kazi yao. Naona nitapona.
March is Women's Month, and as such, this health camp also attended to women from all walks of life. Some of the services provided were cancer screening and reproductive health services under Zuri Health's flagship program, Niko na Choice.
Women should definitely take advantage of such services because there's a lot of services that we are offering that are particularly tailored to the women. Being Women's Health Month, we wanted to give back to the community in a way that particularly addresses the women and the concerns that women have. So we were screening for breast cancer, screening for cervical cancer, fistula, offering family planning services with the Beyond Zero campaign, and also HIV testing, amongst other services that, It's important to screen early because early detection will save lives. We're able to intervene much earlier and prevent the disease from progressing to a much later advanced stage. Of course, overall reducing mortality and morbidity.
This is a very important activity that we are having today. This morning, as we started with going to the maternity, and we had MPESA Foundation giving mothers mama packs for the mothers who are already in our maternity who have given birth there. And this one tells us that we will be able to improve on our services, and including making these mothers more comfortable and actually selling our facility, Naivasha Sub-County Hospital, so that mothers can come and deliver with us for safety of the deliveries and so on and so forth. Number two is that we now came around to Milimani Primary School, where we are having a huge medical camp supported by MPESA Foundation. And this one is going to impact so much on the health of our people. There are so many people who are not able to go and get the services elsewhere. And you can see by the look of it, we were targeting about 5,000 people already. We are over 3,000 people already, patients coming to get these services. That can tell you that we still got a lot to do in our county, but more importantly, that they are going to get quality care today through MPESA Foundation. Remember, we have the structures of governance and everything. For the government itself to succeed in doing such things, we need to collaborate with our partners, like now Safaricom, the MPESA Foundation, other collaborators like the Zuri Health, so that they can come in where we have gaps. Then the partners can collaborate with us, and then they are able now to offer more services to our people. And actually, what I would like to say about the quality health services, which I can see that is what is happening with us today.
For the foundations, we decided to focus on 3 main sustainable development goals, and health is one of those 3 sustainable development goals. So when we come to Naivasha, when we bring the medical camp here in Naivasha, putting into consideration that there is a bigger catchment because of the safari rally that is happening in Naivasha this day, when we come to Naivasha, we give the mama packs to mothers and newborn children in the hospital, just to give them appreciation for allowing us to come and transform lives in their county and also improve access to quality health care for the mothers and the newborn children. As I said, health is one of our pillars. It's one of the sustainable development goals that we chose to focus on. So when we come with a medical camp here, we are basically improving access to health care in terms of people can get access to diagnosis of diseases, mainly non-communicable diseases, and can get access to treatment and referrals. So for us, when we improve access to healthcare, it plays a big role in the bigger picture of the foundation, which we have a strategy that anywhere we go, any life that we touch, we have transformed a life from one place to another. That is what makes the foundation happy.
So we're excited to be here in Naivasha of Nakuru County for the, MPESA Foundation driven medical camps in partnership with the County of Nakuru. And we're super excited because this is what is special. There is a Safaricom rally going around town, so this is a camp special. And the idea is to be able to provide access to healthcare for people in underserved communities and continuity of care. And as you can see, super very well organized. I think we've done over 2,000 patients already, walking them through from registration, triaging, to the labs, medical consultations, and for people who have chronic conditions through the NCD tents, through to eye, dental, and medication. So I think this is an incredible opportunity that the MPESA Foundation is supporting to ensure that people have access to health. And like we always say, healthcare is a fundamental human right. Everybody deserves an access to health. And part of the camp design allows for continuity of care, which means that all those people sitting here for the next 6 months will all have medical consultations with a doctor virtually. Part of what we see here is the intersection between digital health and and technology, ensuring that people using their mobile phones can be able to access health. Like we say today, the mobile is the new hospital.
Today, something good rather than the rally came to Naivasha. MPESA Foundation was able to rally up people so that they can get access to quality healthcare. All this was made possible thanks to the wonderful people of Naivasha.